Welcome to the Real News Network in Baltimore. I'm Kim Brown. On March 4th, at least 50,000 people are expected to demonstrate in defense of the United Kingdom's National Health Service. The demonstration has been called for by Health Campaigns Together, which is a national network of NHS campaigning organizations and unions. Health Campaigns Together was formed by the advocacy group known as Keep Our NHS Public. It's a collective of 40 grassroots chapters. Keep Our NHS Public have a dire warning that, quote, the people of Britain are at a precipice. The National Health Service that has been severely damaged by under-resourcing and privatization, end quote. The healthcare system that has provided cost-effective, universal coverage at free to the point of need is being dismantled. However, they say all is not quite lost. Let's take a look at this National Health Service promo video.
On Saturday, 4th of March, staff,
patients
and users
of the NHS
will march on Westminster.
Years of cuts,
closures, pay freezes
and privatisation have stretched the NHS and its staff to breaking point.
The service cannot continue under these conditions.
Properly funding the NHS is possible.
So join us
on the 4th of March,
when we will tell the government
no cuts,
no closures,
no pay freezes,
no privatisation.
This is our NHS.
And we're here to fight for it.
How about you?
So join us on the 4th of March.
Everyone is welcome.
Find more videos and information on our Facebook group.
Thank you.
Thank you.
Thank you.
Joining us today to discuss the state of the National Health Service in the UK and the upcoming demonstrations is Margaret Ridley. Margaret went to medical school at the age of 18, qualified as a doctor in her early 20s, and later became a consultant psychiatrist in 1985 until she retired several years ago. Margaret was born in 1948, which is the same year that the National Health Service came to be, and she now spends much of her time campaigning with Keep Our NHS Public. She joins us today from the UK. Margaret, we appreciate your time. Thank you so much.
Thank you for inviting me.
So, Margaret, can you start off by briefly describing your background as a doctor and what it is that you do now?
Well, I've become increasingly concerned about the privatisation of the NHS and the fragmentation, and so I joined a local protest group that happened to be Keep Our NHS Public. And so we go to various health service meetings, we challenge what's going on, and we're actually part of a network. I think you said 40 groups. We're over 60 groups, Keep Our NHS Public, and we have many more affiliated groups. So there's a marvellous network through England of groups campaigning. And what's very useful is that we meet regularly and we have updates from other groups about about their successful campaigns, and it's a very useful campaigning network. National Keep Our NHS Public thought it was very important to unify all the disparate campaigning groups and the unions, and so that's why they formed Health Campaigns Together. And so Health Campaigns Together has been the force behind the organisation of this rally on Saturday the 4th of March.
So, Margaret, can you explain to us what has been happening to the NHS? As we heard in the promo video, they have been enduring a series of cuts, of downsizing, of closures. I'm assuming that is of medical facilities. So explain to us, or maybe give us an idea of when NHS was operating at its most effective and compare that to how it operates today.
Well, the privatisation started with the Thatcher Conservative government. The Cabinet actually discussed privatising the NHS and introducing American health insurance. But they decided that doing this in one fell swoop would be too unpopular. So they've gradually done it little by little. And the Blair Labour government continued this privatisation. But things really took a turn for the worse in 2010 when there was a Health and Social Care Act. And this act removed the responsibility of the Secretary of State for providing a health service. That now the Secretary of State just has a duty to promote health. And so that has opened the door wider for privatisation. And then we had, so that was one massive upheaval in the NHS in 2010. And one of their officials, the government officials, described it as such a large reorganisation it could be seen from outer space. We now have Simon Stevens as Chief Executive of NHS England. He had previously worked for United Health. He worked for 10 years in, I think, their global health division. And he has started another complete reorganisation of the NHS, introducing American insurance-style management structures and cutting the budget further. And so that has been going on in the background, and what has really produced the crisis in the NHS this winter is the fact that hospitals have basically run out of beds, because elderly patients who would normally be looked after in the community with social care and nursing homes and residential homes are not able to access these services, partly because the government has reduced the social care budget, and partly because these private homes are actually private for-profit companies. And if they don't make a sufficient profit from looking after the elderly, they close down. So the failure of adult privatised social care has completely destabilised the NHS over the winter, so much so that the British Red Cross has called the state of our health service, in particular our A&E departments, as a humanitarian crisis. And this is a scandal for what was a comprehensive health service.
Margaret, you said... Oh, I'm sorry, continue.
When the post-war Labour government introduced the National Health Service, Nye Bevan, who was the architect of this service, wrote a book entitled In Place of Fear. And the fear then was a fear before 1948 that you couldn't afford healthcare. And people of that generation will describe what it's like watching members of the family die because they didn't have the money to fund healthcare. We now have fear coming back into the NHS. We have fear when you dial 999 for an emergency ambulance for a relative. You have the fear that the ambulance may not arrive in time because the ambulance service is so grossly understaffed. You then have the fear that is the ambulance going to go to the local NHS A&E service? However, that might have been closed, or it might be temporarily closed because there's such a queue of ambulance waiting to get into the A&E that the ambulance is diverted elsewhere. Then you've got the worry of whether your relative's going to survive queuing in the ambulance waiting to get into A&E. And then you have the situation where patients are queuing on trolleys waiting to go into A&E and then waiting to be admitted to the ward. And in a hospital in Worcester in 1 week, 2 patients died waiting on trolleys to be admitted. Elective operations have been cancelled because the crisis not being able to discharge elderly patients into the community because they're actually sitting in the surgical beds. So elective operations have been cancelled. Operations for cancer patients have been cancelled. And if your relative needs a life-saving operation, you've got the problem they might be refused it because there aren't any intensive care beds. So this crisis in the NHS has worsened significantly since Christmas. And this is why we're taking to the streets on Saturday.
Margaret, so help me get a more complete picture here. So is there a private healthcare system that operates alongside of NHS in the UK?
There's always been a small private healthcare system. And what previous governments have done they've kind of contracted out routine surgery to the private sector. They actually pay private hospitals more to do the operation than they pay the NHS hospitals. And of course, the private hospitals don't have to pay for staff costs and staff training. So there's always been a small private service, but with the previous reorganisations, NHS hospitals can now earn, I think it's 49% of their income from private patients, and so a lot of hospitals are actually expanding their private work.
So help us also explain or help us understand like how NHS has been politicized in the UK, especially recently with the Brexit vote, with those who were in favor of Brexit, such as Boris Johnson and Nigel Farage, really pushing this idea that Britain was sending its dollars to the European Union that could have been better served at NHS. So how has NHS been politicized, sort of used as a political football in the UK?
Yes, it was used as political football. We're quite sure that those people who said that they would divert money to the NHS weren't telling the truth, and they haven't diverted any money to the NHS since we voted to leave Brexit. I think the government is still maintaining that they're not privatising the NHS. The Prime Minister announced in Parliament recently that they were not privatising the NHS the same day as I think a South West service announced they'd given a contract for out-of-hours services, emergency services, to a local private-for-profit company.
Margaret, what parts of the country have been most harshly affected by resource cuts and privatization?
The north of England seems to be the hardest hit, and perhaps a third of A&E departments, maternity, paediatric departments, are threatened with closure. In fact, the organisation that initiated the march on Saturday was from Huddersfield, and their hospital is under serious threat.
So, Margaret, why has there not been, or rather, why has there not been a stronger outpouring of anger towards government to change its policies towards NHS? I mean, the fact that Britons have had this universal healthcare system has certainly been the envy, or the envy at least of some Americans, and even other places as well. So why has the government been allowed to incrementally privatize this, what seems to be something that is quite valued by the English?
Yes, I think firstly, people believe what the government says. The government says they're not privatising it, but then public opinion is becoming more concerned about how the NHS is managing. But the main reason, I think, is that the government maintain that they haven't got any money. So they follow this neoliberal nonsense. And the public, because the government says that they have to balance the books like running a household, people believe them. And the mainstream media have only just recently started talking about the crisis in the NHS, but they have not at any stage mentioned that this political austerity is what it is, political austerity, that there's no basis for this in economics whatsoever.
And Margaret, lastly, I mean, you were an exceptional student, obviously, being admitted to medical school at the age of 18. You qualified as a doctor in your 20s. Describe for us how drastically NHS has changed from when you were working as a practicing psychiatrist back in the 80s to what it is now.
I think that the pressure on the staff has increased tremendously. I've come across so many staff now who say that they finish their shift on the verge of tears because they feel so ashamed of what they're doing. They know that what they used to do was provide a much better service, and now they're so rushed they don't have time to discuss things with patients. And I think that they just become so demoralised.
Indeed. Well, we certainly hope to get an update after the march, which is scheduled for March the 4th. in the UK. Is this going to be held in London? Where is this march going to actually
Yes,
take
yes,
place?
it's in London.
All right. Well, we've been joined with Margaret Ridley. She is a retired doctor. She's also now working with the organization Keep Our NHS Public. On March the 4th, there will be a demonstration expected to draw as many as 50,000 people, perhaps more, to protest the ongoing privatization and budget cuts to Britain's National Health Service. Margaret, we really appreciate your time today. Thank you so much for joining us.
And thank you very much for having me.
And thank you for watching the Real News Network.